Hi, I'm with Dr. Uzel at Mercer Center for Implants and Periodontics at Princeton, where we are at an office that is science-based and ethics-backed. Dr. Uzel, can you tell me a little bit about what it's like to be a periodontist?
A periodontist is essentially a gum specialist, we call it in plain language, who treats gum disease, does gum surgeries, implant dentistry, bone grafts, extractions. It's mostly a surgical specialty. I'm a board certified periodontist. I've been board certified for more than 20 years. I've been a periodontist close to 30 years. And I've taught at two respected dental schools, Penn and Boston University, for a total of 13 years.
Mm-hmm.
So it's a fulfilling profession and specialty because we help a lot of people. Periodontics or periodontal disease is related to overall well-being of a patient. It's a treatment of gum disease or periodontal disease is a medical necessity, and the disease is directly correlated with diabetes. Has been bacteria that cause that disease have been found in heart arteries, pancreatic cancer cells, etc. So it's a quite important disease to be addressed, and also increases the quality of life of patients with no bleeding gums when we treat them, no bad breath, no tooth loss. The most number of teeth are extracted because of gum disease. So it's a great profession for helping people. It's demanding, it's surgical. We have to make people comfortable. We use local anesthesia or sedation, and people are comfortable and happy in the end of those procedures, as much as we can accomplish that for them.
Right.
Okay.
And what made you want to go into the field? I know you shared a lot about how gum disease can kind of parlay into other health complications, but what made you specifically want to go into the subspecialty?
Well, I come from a family of dentists. My father is an orthodontist, but it's a non-surgical specialty. When I was becoming a dentist, I was involved with surgical treatments in my dental school, which excited me a lot more than orthodontics. So I decided going towards a specialty that can give a full scope of treatment to patients, which is periodontics, because we can determine which teeth are good to keep for a patient, of which are not, and we can plan implant treatments pretty comfortably that way. And that's the reason why. It's a surgical specialty, which I loved growing up. So that's why.
So it's really like multifaceted.
Yes.
And you said it's non-surgical, but you're doing a lot of things.
Yeah, we do a lot of things. Well, periodontics is a surgical specialty.
Right.
That's the reason why I chose it. But we have a lot of non-surgical treatment options as well for those who cannot undergo surgical procedures or who don't want. However, of course, the ultimate treatment is the best treatment that can be given to a patient. So we recommend the best possible option to them.
Right.
And then there are alternatives that may be non-surgical.
So really individualized to the patient's needs.
That is, every treatment plan we recommend is based on patient's needs and wishes, but not all the wishes can be fulfilled, of course. Yet we consider our patient's contribution into the treatment plan and may make alterations accordingly. Yet we do the best possible treatment for them in the end of the day.
Of course. And in addition to ethics and individualization of your practice, what are some other things that set your practice apart? Technology, scientific approach?
Yeah. So we use the latest technology with 3D computer imaging. We have digital scanners, so forth and so on. But I'm also a bone biologist in addition to being a periodontist. I have a Doctor of Science degree in bone biology. So we add that into our practice because what I deal with is bone routinely.
Mm-hmm.
So my scientific background and evidence-based treatment of our patients sets us apart. Of course, we make him very comfortable in this practice. That's
Mm-hmm.
our goal. So whatever we do, in addition to the evidence-based and technological dentistry, as you can see here, our waiting room is like a living room. We don't have a
Mm-hmm.
TV set, but other than that, we have everything else, a coffee maker, etc. So
Mm-hmm.
we like him to be comfortable in every aspect of our treatments.
Mm-hmm. You have kind of a duality between technological advancement, science, and then comfort.
Very good.
How do you and your team make patients, such as those with anxiety or maybe special needs, feel more comfortable other than what you've already stated?
Well, we treat our patients in several different ways. We do surgical, non-surgical treatments, and those require anesthesia of some sort.
Mm-hmm.
Local anesthesia for minor procedures is recommended. However, we have many patients who have fear of dentists, or we operate on them extensively. Full mouth surgeries are not uncommon in our practice. We have special needs kids. In that perspective, we use sedation. So sedation is the best way to go. By a board certified anesthesiologist, of course, is the way to go. So it's very safe for patients. Everything is perfectly achieved. I focus on my procedure, and our doctor who sedates our patients takes care of the business for us in that aspect. And the beauty of it, all the medical clearance is done for patients prior to us seating them. If there are any medical issues that arise alongside that, they're all taken care of prior to it. An interesting story, Dr. DeMarco, whom we work with extensively for this purpose, he diagnosed a patient who had a heart attack, but he hadn't known it.
Right.
So that patient was treated first with stents before I saw him 6 months later. So that was a lifesaver for that patient to go through sedation, and especially with Dr. DeMarco, who saved a life and also saved a lot of problems for everybody dealing with it.
Right.
So that's important to have someone who's super like himself, and also that comfort that we give the patients who cannot tolerate regular dental treatments with just local anesthesia is very important.
So it's very interesting how it is the scope of your practice and your work is beyond just dentistry. It is the full body.
Yes,
really.
of course. It's the periodontitis affects the whole body because it's a systemic medical condition by definition, although it occurs in the mouth. The bacteria that cause the periodontal disease circulate in the whole body. So mouth is the entry port of everything. A lot of bacteria in there. I'm not talking about a social part of it, bad breath, teeth that are loose, etc. But for overall well-being, that disease has to be taken care of one way or another.
Of course, of course. And can you share a memorable patient success story or a transformation you've seen in your office that was specifically impactful?
Well, we have many patients who have benefited out of treatments we give here. Most recently, we had a case where with a gentleman who had his teeth all abrased to the bone level. They were not decayed, but with this bite in time, those teeth were at root level and he couldn't eat anything for years. So unfortunately, they couldn't have been treated successfully with conventional dentistry. So we did what's called, it's popular, we don't always do it, depending on patients' needs and requests. But we did what's called an all-on-X treatment, full mouth. It came out beautifully. It changes his life because before he looks now 30 years younger, but also he can eat.
Yes.
And there are so many other patients like him with different aspects of what I do. Gum disease is an annoying disease in a sense. It's a chronic condition. A lot of bleeding gums. Bad breath is a common issue. A lot of times wives complain about it, and husbands have to come here. Don't like to undergo treatment sometimes, but they have to do it. So that helps with relationships
Right.
among couples. So, and also health, of course. But we have many people who have completely changed. The confidence level has changed because of the good dental treatments
Right.
customized for them,
Right.
completed here.
Right. So again, like you were saying before, it improved a social aspect.
Most importantly, yeah.
Most importantly, which then goes into emotional, and let's be honest, that could also impact health.
Yeah.
So it's really an all-around inclusive type of practice.
Yeah.
And what advice would you give someone who was nervous about having a dental procedure?
Yes. So when we have someone who's very nervous, which happens a lot, we recommend them sedation. That helps them being comfortable without feeling what we do, because there is that aspect. Local anesthesia helps being numb, but the sensation of undergoing a treatment consciously, or sometimes, of course, there's movements we have to make within the mouth. A group of people cannot tolerate that. So in that case, IV sedation is the best way to go. And we offer that to our patients, especially when it's a larger case, like the gentleman I just talked about, the success story patient. We tell them this is a larger scale treatment, therefore it's advisable to consider sedation regardless how much fear you have, because some people think that it's simpler and it becomes problematic during the procedure. So we don't want to have a less than ideally performed procedure for people. So especially for larger scale treatment that we do a lot here, we recommend sedation. And people may go that route as they understand our explanations about thinking about it and doing it are two different things. And if you don't feel like you can tolerate the whole procedure, that may take 3 to 4 hours sometimes. It's worthwhile doing the sedation, and that way we can do the best possible treatment for them.
Right, right. Customizable, like you said, which is essential, but within their own means of comfort. How has partnering with a professional anesthesia service such as MASS changed your daily workflow? Does it make it more efficient? Can you talk a little bit about that?
Yeah, well, first of all, it helps us making our patients comfortable with procedures we do. For our daily workflow, everything is taken care of by the anesthesiology team. Therefore, we're very comfortable going into the surgery with them. We have a special setup for those mornings we typically do with Dr. DeMarco, and we have, it's well set up. So our daily routine doesn't really change in that sense, but we reserve that time slot for sedation. So I don't side book anybody for that purpose, but it's a quite smooth ride because everything is well planned ahead of time, and we do never encounter with any issues during or after or before the procedure. So we come in, the exact gameplay. It's like a good rock band, if you will, right?
Right.
That have been playing together for 30 years. The Rolling Stones. I saw them the summer before. They've been playing before I was born. So, the show was great, outstanding, but they know who's doing what exactly. So in our aspect, we do the same thing. We know how the anesthesiology team works. Our front desk coordinates with the office over there. Patients are coordinated. Medical history is coordinated.
Right.
Everything is smooth. So our workflow is wonderful when we do that. To me, it's very, very comfortable.
Yes, it sounds like it's pretty much the same. No overhead for you. You kind of just go into the procedure.
Exactly.
And you're able
exactly.
To focus.
So the most important thing, some doctors do both together. I want to emphasize that. I make that silly joke. I cannot cook a fancy dish and also put you to fly an airplane at the same time.
Right.
Those are two different things.
Right.
So they have to be. It has to be done by two distinct doctors who do their fields really well. So I do only what I do better, and then rely on to the anesthesiologist to take care of the rest.
Right.
So that's very important to be emphasized as well.
Because you can't play the drums and the guitar at the same time.
Beautiful analogy, better than mine. I'll use it next time. Don't copyright it
I was
yet.
trying to go along with you with the Stones. There.
Yeah. That's a beautiful analogy. Thank you.
So what is your philosophy on preventative care?
So what I tell my patients, I don't like extracting teeth. Although I've done more than anyone you would meet probably. I make that joke saying I was Mr. Extractor in 1999. It's a joke I make to patients to make them comfortable. But truly, I've extracted too many teeth. I don't want to do that.
Right.
So I tell my patients, I see problems here. I can take care of them for you with no tooth loss or minimum tooth loss, and must follow my lead. In that case, it's a preventive care. And for gum disease, it's a chronic condition. We make sure we program their maintenance care properly in between us and referring dental offices. So that way, it's also preventive care. So we don't, of course, do preventive dentistry per se. Most of pediatric dentists do that kind of work. But for gum disease purposes, we alert people before problems occur. So we prevent bigger problems, bigger costs, bigger infections, etc. So I'm all, I reveal all the information in plain language. We use technology, as we said before. Therefore, I can point out the problems on a CAT scan, and they can see what I see if they're described properly, of course.
Right. It kind of provides a visual way for them to see the underlying problems so that they can get ahead of them.
Beautiful, yes.
How do you stay current with the latest techniques and technology?
Well, the techniques and technology, reading is the most important thing. There's a evidence-based. There is a concept called critical reading, meaning I don't believe in everything I read. I look it up. I check their data if it's accurately analyzed. There's a lot of, as I did research and published on my research back in the day, I'm familiar with how those projects are done, how the data analysis can change things in representation. So I can read those in more critical ways. That helps me making proper decisions for the newest techniques. And if it's a technique that's worthwhile using in our office, we do. The same for technology. Now, in implant dentistry, the technology is driven by computers, of course, the computer science, which is something I'm not an expert of, but I can see the results in that sense. So the improvements are more made in that aspect, more precision with implant dentistry, the crowns, the teeth, and etc. are placed properly, more precisely for patients. So we definitely bring those latest technologies in our office. We use photogrammetry, intraoral scanning, etc. that make things a lot more precise and longer lasting for patients. So that's one aspect. The scientific part, I make decisions. Of course, we take CE courses and attend meetings, so forth and so on, and make decisions based on the evidence that we are provided during those presentations.
Right. it's really evident how you are a scientist, but you're also a periodontist.
Yeah.
And you've merged that really beautifully
Yes. Thank you.
here. Thank you so much for your time.
Thank you for your time.
Dr. Uzel, thank you. Thank you.
You're welcome. Thank you.